Okay, so now I will evaluate the right leg, which in Hoshino Therapy, when we approach an injury to the low back, we are not going to can I start that over again? Okay. Okay. So now we will evaluate the right hip, hip flexors and lateral rotators, and the hamstring and the adductors. This leg was always more flexible and stronger and in better shape than the left. And so I'm going to use this as a basis for the changes that I want to see in the left leg, because I want them to be as symmetrical as possible. This is the problem with gait and low back injuries in its chronic form and its postural form, because a lot of people get into poor postural habits and they actually are walking unevenly. They use one leg differently than the other. This eventually causes the spine and the pelvis to rotate, then causing nerve impingement and ultimately bulging of discs and subluxation and down the line herniation from wear and tear. So in order to correct that, we want to find and create as much symmetry and balance and muscle tone and a joint alignment of the spine and of the leg, from the toes all the way up to the low back and even mid-thoracic. So in Hoshino Therapy, we do not focus on the site of injury solely. We are looking for balance and symmetry between both sides. So we always treat both sides of the body, even if the pain is only on one side. You will often find sometimes trigger points on the opposite side of the leg that's injured or the arm that's injured that are more severe than on the side that's injured. This is a compensation of the nervous system and of the muscular system in order to guard and also protect the injured area. This is a double-edged sword, because in the long run, if it's not corrected, it prevents the person from fully rehabilitating and also leads to other injuries, secondary and even tertiary injuries, that are coming because once the body's injured, it goes into spasm and people start compensating and they create other problems in other areas. And that's what we want to avoid in this time when we're treating her, that we isolate the areas that are injured and protect the areas that aren't injured in order to get the best result possible. So we always are looking at the body as a whole, even though we are focusing on L4, L5 herniation, and L5 and S1. That is our focus, but in order to get there, we are going to treat the whole body, and any improvement that we make is going to minimize the pressure and the stress on our body, giving her a better healing and a better result in the long run. So we always work evenly both sides of the body, and then we will focus on the area which is affected. And I also need to work on the opposite side for reference to what's happening on the left, in order for me to figure out the best way to balance her. We are finding on this side, although it is not as tight as on the left, in the same areas affected, she also has the very strong trigger points on the peroneus and on the tibialis. So I want to make sure I relieve those two on the right side. Also, this being her good leg now, she has come to rely on it much more when she's walking because she's limping right now. So in order to get her through this, I want to make sure that the right leg stays in good shape and good condition because she's going to be overusing it during this period of time. Now, I know from experience in working with many lower back herniations that we have a timeline here that we can expect. In the best cases, manually treating these conditions, we can expect there are at least 6 months of therapy, if not 9 months, before she will be ready for a normal rehabilitation with a physical therapist and going to the gym and yoga and other kinds of working out. At this stage, though, it's very important that she doesn't stretch or do any weights or any aggressive impact therapy. I have her now mostly exercising in the water or doing stretching very gently on her back in a safe position, not weight bearing where she can possibly do any damage to the low back. We put her in the water, which I like her to be in the water, just floating on her back every day for a half an hour to 1 hour, once or twice a day. This is because the water is the only place where we can get away from the gravity. And when a disc is herniated and the annulus bursts and spills out into the spinal cord, which is what it has done, into the foramen of the spine, until the body absorbs that and the swelling goes down, the spine is going to be very unstable. And the water is the safest environment because it takes the gravity off of the disc and also allows the disc to actually expand and allows it to heal best. So for the first couple months, when I have a client like this with a severe spinal injury, I do not want them doing any weight-bearing activity. The weight-bearing of just getting in and out of bed and standing around and sitting is oftentimes more than they can handle. So we certainly don't want them to do anything else until finally the herniation has healed and the pressure on the spinal cord has been relieved. Then once I feel that that has happened and I see the signs that she has recovered and that the disc has scarred up and healed, then we are ready to start doing the next phase of rehabilitation, which will be much more aggressive stretching and weight-bearing activity and strengthening. But until I find the low back is stable, we do not want to do that because we can actually cause serious damage to the spine and the nervous system when the spine is floating like that. Also, heat and ice have been very important for her, even more important than the anti-inflammatories, because the regular application of ice to the L4 and L5, bringing down the swelling on the nerve, and then the heat, actually not for L4 and L5, but for the muscle and tendon, in order to heat it up and soften it and improve circulation. Because what happens when that nerve gets inflamed, it causes the entire lower body to go in spasm, especially when it's on L4 and L5 on the main sciatic branch. Then the inflammation just spreads through the nerve to all the muscles of the body, causing them to contract. That contraction then is what impedes the body from healing, because it puts more pressure on the low back and the spine, and it never gets a chance to get rest and recover. Even when the person is sleeping, the muscles are busy working and contracting, and the person slowly gets worse and burns out. So it's very important that people recognize that when they're working on this, is that it's not just the L4 and 5 injury that we are looking after. We are looking after the entire body and all the side effects that happen along with that injury. Okay, now in the beginning we had to be very careful when we moved Liz, because she couldn't roll over to the side and hardly could get up and sit up. Now that's not a problem anymore.